Welcome to the comprehensive course on interstitial lung disease, ILD. In this course, we will explore the anatomy, pathogenesis, clinical presentation, diagnostic criteria, management, and future directions of ILD. Let's begin our journey into this fascinating world. The interstitium is a complex network of connective tissue that supports the lungs and facilitates gas exchange. Type I and Type II pneumocytes play crucial roles in this process, making understanding the interstitium important in studying interstitial lung disease. In the pathogenesis of ILD, environmental triggers, genetic predisposition, immune dysregulation, and epithelial mesenchymal transition interact. These factors include exposure to harmful substances, genetic variations, immune system abnormalities, and a process where epithelial cells acquire fibrotic characteristics. Understanding these mechanisms is important for effective treatment. Interstitial lung disease, ILD, presents with various symptoms, making diagnosis challenging. Symptoms include dyspnea, cough, fatigue, and exercise intolerance. Thorough history, physical examination, and laboratory tests are essential for diagnosis. A systematic approach is necessary for accurate and timely diagnosis. High-resolution computed tomography, HRCT, scans play a central role in the evaluation of ILD. They allow for the visualization of subtle parenchymal changes and help differentiate various radiographic patterns associated with different ILD subtypes. Ground glass opacities, reticular patterns, honeycombing, and traction bronchiectasis are commonly observed findings. The presence and distribution of these patterns aid in narrowing down the differential diagnosis and guide subsequent diagnostic investigations. Careful interpretation of HRCT images in conjunction with clinical and histopathologic data is crucial for accurate classification of ILD subtypes. In this section, we will explore the principles of spirometry, diffusing capacity measurements, and lung volume assessments in ILD. These tests help evaluate the severity, prognosis, and therapeutic response in ILD patients. Spirometry measures airflow limitation, diffusing capacity assesses gas exchange efficiency, and lung volume assessments provide insights into lung compliance and hyperinflation. Understanding the expected changes in different ILD subtypes and their correlation with radiographic and histopathologic findings is crucial for interpreting these tests. Histopathologic examination of lung tissue samples is often required to establish a definitive diagnosis in ILD patients. Transbronchial, surgical, or cryobiopsy procedures may be utilized depending on the clinical scenario. Microscopic features in ILD vary depending on the subtype and include cellular inflammation, fibrosis, granuloma formation, and vascular remodeling. Identifying characteristic patterns, such as usual interstitial pneumonia, UIP, in idiopathic pulmonary fibrosis, IPF, non-necrotizing granulomas in sarcoidosis, and bronchiolitis in hypersensitivity pneumonitis, is essential for accurate diagnosis. Familiarity with the histopathologic patterns and appropriate sampling techniques is crucial for pulmonary pathologists and clinicians managing ILD patients. In this section, we will comprehensively study specific types of ILD, including IPF, sarcoidosis, hypersensitivity pneumonitis, and connective tissue disease-related ILD. Each subtype has unique clinical, radiographic, histopathologic, and management characteristics. It is essential to understand these details for accurate diagnosis and personalized treatment. The management of ILD necessitates a multidisciplinary approach involving pulmonologists, radiologists, pathologists, and rheumatologists. Early and accurate diagnosis is vital to initiate appropriate therapies and optimize patient outcomes. Management strategies vary depending on the specific ILD subtype, disease severity, and comorbidities. Treatment modalities may include pharmacological agents such as antifibrotic agents, for example, pirfenidone and nintedanib, immunosuppressants, and targeted therapies. Pulmonary rehabilitation and supplemental oxygen therapy play a crucial role in improving functional capacity and quality of life in ILD patients. Collaborative decision-making and close monitoring of disease progression are essential in the multidisciplinary management of ILD. In this section, we will discuss the different treatment options available for interstitial lung disease, ILD. Pharmacological therapies such as antifibrotic agents, immunosuppressants, and targeted therapies will be explored. We will also look at the role of pulmonary rehabilitation and supplemental oxygen in improving quality of life for ILD patients. Apart from HRCT scans, emerging techniques such as positron emission tomography, PET, scans and quantitative imaging analysis offer additional insights into ILD assessment. PET scans utilizing various tracers can provide information on metabolic activity, inflammation, and fibrosis, aiding in disease activity assessment, response to therapy evaluation, and predicting outcomes. Quantitative imaging analysis involves extracting objective and quantitative measures from radiographic images to assess disease severity and track disease progression. Familiarizing oneself with these advanced imaging techniques enhances the diagnostic accuracy and sheds light on ILD management. Assessing disease severity and predicting prognosis in ILD patients requires the utilization of various clinical, radiographic, histopathologic, and molecular markers. Biomarkers, such as serum markers, for example, Krebs von den Lungen 6, and gene expression profiling, provide insight into disease activity and progression. Scoring systems, such as the GAP, Gender, Age, Physiology, Index and the Calm Acute Exacerbation, A, Index, help stratify patients based on mortality risk and aid in treatment decision-making. Proper integration of these markers and scoring systems into clinical practice assists in prognostic assessment and improves patient management. Ongoing research in interstitial lung disease, ILD, aims to understand the underlying molecular mechanisms, discover new treatments, and explore personalized medicine approaches. Targeted therapies, genetic studies, and advancements in genomics and molecular profiling hold promise for improving ILD management and finding a cure. Engaging in research and staying informed about these future directions is essential for better outcomes in ILD patients. In conclusion, we have explored interstitial lung disease in great detail, covering its various aspects such as anatomy, diagnosis, treatment, and future directions. By expanding our knowledge, we can improve the care and outcomes for patients with this complex condition. Thank you for joining us on this enlightening journey.